Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician. Revise with me homeopathic remedy Bryonia Alba. This is part 7, clinical correlation. The text is taken up from Allen's keynote, and this is a good revision for BHMS students and interns. So we go to the first PQR. Is best adapted to persons of gouty or rheumatic diathesis prone to so-called bilious attacks. So we will think or discuss about gouty diathesis. There is a family history positive for gout, and the common age when it affects is 30 to 50 years, and predominantly the males are affected. Others risk factors include obesity, hypertension, diabetes, hypothyroidism, psoriasis, hemolytic anemia, and drugs like iatrogenic cause is diuretics. And if you investigate, you will find the uric acid is at high level. A lifestyle that triggers the gout is sedentary lifestyle, diet rich in red meat and shellfish, especially beverages include sweetened fruit, sugar, alcohol consumption, especially of beer. And to help the patient, we should have the lifestyle intervention, which includes weight loss, smoking cessation, exercise, increased coffee and dairy intake. Dietary modification includes take low prurines, if uric acid is within acceptable limits below 6 mg DL, probably gouty attacks will not be there, but if it is more than 6, it is a very unhealthy trend and people may suffer from gouty attacks. So there are certain levels which are good, like 5 or less milligram DL is the safe limit, 5 to 6 is good, 6 to 7 is a kind of warning or preclinical stage, and over 7 you are in a dangerous zone where the gout can be symptomatic. Again we will see the PQR1, the bilious attacks. And rheumatic diathesis, we have individual, from the point of rheumatic diathesis we have a very wide area which is included in this term. The individual is prone to develop joint affections characterized by pain, stiffness and inflammation, and we study such conditions in rheumatology, all musculoskeletal disorders, and they are included under the term rheumatism. There are more than 200 distinct rheumatic diseases we have. Among the most common ones are osteoarthritis, which includes the axial skeleton also, cervical spondylosis and lumbar spondylosis, rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, gout, even a scleroderma and infectious arthritis are included. Juvenile idiopathic arthritis is in children's. So we understand that such people who are having this diathesis, they are also prone to so-called bilious attacks. The word bilious goes back to the old belief that there were four bodily humors: black bile, yellow bile, phlegm and blood. And these four humors determine the person's temperament. Bilious personality type is associated with excess of bile, yellow bile especially, and bilious has got more or less very broad meaning, and three of them are very important to know about. It means relating to bile. By extension, bilious means suffering from liver dysfunction and especially secretion of bile, and further, by extension, it is indicative of peevish, ill-natured disposition. Clinically, the bilious attack includes a group of symptoms consisting of headache, abdominal pain and constipation. So let us recall, the word bilious derives from the French bilieux, which is in turn comes from bilis, the Latin term for bile. We go to the PQR second. Bryonia patients are irritable, inclined to be vehement and angry. And PQR3 tells us about dark or black hair, dark complexion, firm muscular fiber, dry, nervous, slender people. So PQR2 is about the mental attributes of Bryonia patient, and PQR3 tells us about the somatic or physical attributes of Bryonia. Let us see the Bryonia mind. Bryonia during the adaptive phase is full of energy and aggression, task-oriented people, full of confidence, highly ambitious and good planners. However, under stress, when they get maladapted, we find they are prone to anger, cannot bear contradiction, they have a superiority complex, and they can be deceitful. At times, their attitude appears to be unsympathetic and unemotional. When we talk about the physical attributes of Bryonia, we find that the choleric temperament has predominance of bilious humor that gives them a warm, dry, lean, rectangular or square body, tight muscles and connective tissue, yellowish coloring and tendency to be irritable, angry and impatient. Clinically, when they get into maladaptive phase, they are prone to insomnia, hyperacidity, aggressive behavior. We go to the PQR4, and here Ellen tells us about the pains, and there are different kind of pain which we encounter in Bryonia. They are stitching, tearing, worse at night, worse by motion, inspiration, coughing, and they are better by absolute rest and lying on the painful side. So let us see what conditions we can encounter. This generally, if you go for the adaptive nature of pain, it is a protective mechanism for keeping our body safe by notifying damage to the tissues. The pain receptors are the nerve endings present mostly in the body tissue. They respond to any damage. Sharp, stitching and tearing pains, especially they come from serous membrane like peritoneum, pleura, pericardium, and other tissues like joint component, ligament and synovial membrane is very important. If you see the pleura, the parietal pleura is pain sensitive. In case of dry pleurisy, the most common symptom is sharp chest pain while breathing deep. In the case of diaphragmatic pleurisy, pain can be felt in the shoulder. It is a referred pain phenomena. The pain is worst on coughing, sneezing, and it is relieved by pressure and lying on the affected side. So pleuritic pain will find symptoms under stitching chest pain, which sudden, increasing with respiration, coughing and movement. Pleuritic cough is a dry cough due to irritation of pleura. And there can be dyspnea due to restriction of respiratory movements and also contributed by the development of effusion later on. So this diagram shows the effusion part, later part of dry pleurisy. On inspection, you will find on the affected side the limitation of chest movements or respiratory movements will be there. On palpation, there can be pleural rub occasionally. You may be able to feel it. On percussion, the affected part will show tenderness, and on auscultation, you can listen to pleural rub. General features will be present. They include fever, headache and malaise. We go to PQR5. Bryonia has excessive dryness of mucous membrane of entire body. Lips and tongue dry, parched, cracked, stool dry as if burnt, cough dry, hard, racking, with a scanty expectoration. Urine is dark and scanty, and there is great thirst. Clinically, let us try to understand why there can be excessive dryness. Dry mucous membrane is a sign of dehydration and can cause various health problems. For example, dry mucous membrane in the lining of nose can cause frequent bloody noses. As dehydration increases, signs and symptoms they develop further. And these include there is a thirst, restlessness, irritability of behavior, decreased skin turgor, dry mucous membrane, sunken eyes, sunken fontanelles, especially in infants, and absence of tears when crying vigorously. Dry mouth is a common symptom of high blood sugar in people with diabetes. Sometimes dry mouth is the first noticeable symptom of diabetes. Please note, dryness and dehydration may look and even feel similar, but they are two very different things. Dry skin results from too little oil, while dehydrated skin is due to lack of water or hydration. PQR6 is vicarious menstruation, nosebleed when menses should appear, blood splitting or hemoptysis can be there. ocular vicarious menstruation, and this is nasal vicarious menstruation, pictorially depicted here. The vicarious menstruation represents cyclic bleeding in extragenital organs during a normal menstrual cycle. The reason is hormonal fluctuation around the menstrual cycle, which leads to a nasal or mucosal congestion. Especially the estrogen levels when dropped, the small blood vessels inside the nose become more fragile, and they are otherwise also very fragile, and the patient starts bleeding. Women have blood from their eyes, noses, mouth, skin, and even lungs during their periods, and it is probably occurs because the capillaries all over the body become soft during menstruation. PQR7 tells us about ailments from Chargin, mortification, anger, violence with chilliness and coldness, after anger chilly but with head hot and face red. We have exciting causes, emotional causes here, which create certain diseases or symptoms in the Bryonia patient. Chargin is disquietude or distress of mind caused by humiliation, disappointment, or failure. This kind of emotional trauma may give rise to somatic symptom disorder, and this SSD was formerly known as somatization disorder or somatoform disorder. It presents as physical symptoms including pain. However, SSD symptoms may or may not be traceable to physical cause, including general medical conditions, other mental disorders or illnesses, or substance abuse. But regardless, they cause excessive and disproportionate level of distress. The symptoms can involve one or more different organs, body systems such as pain, neurological problem, gastrointestinal complaints, sexual symptoms, and they belong to the group of medically unexplained symptoms. PQR8. Here we find complaints when warm weather sets in after cold days, from cold drinks or ice in hot weather, after taking cold or getting hot in summer, from chilling, when overheated, kicks the cover off, from exposure to draft, cold air, suppressed discharges of menses, milk or eruptions of acute exanthema. So let us recall, as the warm weather sets after cold, this is a very ideal time for pathogens to thrive and spread in this environmental conditions. The most common illness during summer season includes asthma, as flowers bloom and they shed pollens, conjunctivitis, eye sore, chickenpox, measles, they are both contagious disorders, mumps, that too also a viral disease and contagious disease, influenza causing cough, cold and fever, food poisoning, bacteria which multiply faster in warm weather can always cause gastroenteritis in susceptible individuals. Typhoid and paratyphoid is common, which is also a waterborne disease. Hyperthermia or heat-related sickness. Heat exhaustion, heat cramps and heat stroke is also very common. Sunburn and sun rashes are common due to sun exposure. PQR9, one of the chief characteristics of Bryonia is aggravation from any motion and corresponding relief from absolute rest, either mental or physical. Clinically, anxiety represents a mental state. However, our bodies and mind are closely connected. This means that the anxiety symptoms can often manifest in form of very real physical symptoms and physical symptoms in the form of emotional or mental level, and very common expression is anxiety. So it is a vicious circle. Social isolation. These emotional problems, they can cause social isolation, poor mood, and they have anxiety, poor sleep, inactivity, and in the center of it remains the pain, which can be emotional or physical pain. And whenever we have diseased pain because of any reason, we find that the pain causes muscular spasm. Muscular spasm causes further pain, and if there is a emotional cause like fear, anger, frustration, that stress also causes muscle tension, and emotional frustration etc. will ultimately be resulting in depression, fatigue, and these particular symptoms, negative thinking, negative mood swings, ultimately cause bodily aches and pains. They convert their emotional symptoms into the physical symptoms. So it is a vicious circle. With Bryonia, the mind and body is very intricately related. Anything goes wrong anywhere will affect the other part. PQR9, one of the chief characteristics of Bryonia is aggravation from any motion and corresponding relief from the absolute rest. Let us recall this particular pain phenomena, and whenever we are dealing with pain, we should have the pain questionnaire, and PQRST is the short mnemonic for that questionnaire, and whenever we inquire about the pain, we should be able to always remember this small mnemonic. Here P stands for provoking factor. What is the provoking cause for pain? But what makes it worse? What makes it better? And Q stands for quality of pain, how it feels, what kind of a sensation is there. And R stands for reason or radiation, what is the location and what is the radiation. And S stands for severity of pain, what is the intensity and what is the time. T stands for time modality. So this is the totality of the pain we need to be inquiring into when we decide about the intensity of pain or your quality of pain, and then we have to give the value. What is the intensity that is going to decide about the emotional reaction to that pain. And same time we need to evaluate whether it is a acute versus chronic pain. So if the acute pain is there, then onset is sudden, cause is injury, infection and surgery, duration is 6 months or less, and it resolves with the treatment. But chronic pain, onset is insidious, cause is generally degenerative or autoimmune disorders or malignancy, and lasts for more than 6 months and persists in spite of treatment, we go to the PQR10, desires things immediately which are not to be had or which, when offered, are refused. It is a mental general. And then PQR11, children dislike to be carried or to be raised. These features point to the temper tantrum. Young children at an early stage of social, emotional and language development, and they are at times unable to communicate their needs and feelings, including the desires. The tantrum are one way of expressing and manage their feelings and try to change what is going around them. So clinically, the following facts can be of root cause of tantrum to take place. Say for example, temperament, children who are at the center stage in their families, like a single child. When his demands are immediately fulfilled, they are not taught that if they want something, they should demand it properly, and it may take some time. Children under stress, maybe they are hungry, tired, or overstimulated. Children unable to cope with situations, trouble if older children take away their toys. And strong emotions, fear, shame, anger can be overwhelming for a child, and he behaves in a very different way, which we can call temper tantrums. Tantrums are a normal part of child development and represent a violent emotional outburst in response to frustration. Children may scream, cry, thrash, roll on the floor, throw things, and stomp their feet during a tantrum. Tantrum that last more than 25 minutes may have underlying problem. A normal child may have a tantrum that lasts an hour, but the next one will last 30 seconds. These children with psychiatric disorders are having 25 minutes or longer tantrums at 90% of the time. PQR12 tells us about the delirium, talks constantly about his business, desire to go out of bed and go home. So delirium generally is a transient reversible mental dysfunction, and it is clinically seen in febrile or toxic state and a wide range of neuropsychiatric abnormalities. The most common causes include general medical condition like systemic infection, metabolic disturbances where we have liver and kidney diseases, drugs, anticonvulsant, antidepressants, and substance intoxication like alcohol. Substance withdrawal, we have the alcohol is a good example over here. And clinical features, you find that onset is sudden, acute. Vital signs, abnormal fever and tachycardia may be present. Course is fluctuating. Duration, it may take hours or weeks. Consciousness is altered. Attention is impaired. Alertness is impaired. Behavior, usually agitated withdrawal is there. Speech incoherent, rapid or slow. Psychomotor changes, they can be increased or decreased. Reversibility, the condition is reversible. PQR13 tells us about the constant motion on left arm and leg. Clinically, the above feature represents simple partial seizures or Jacksonian epilepsy. The intracranial causes include tumor, hydrocephalus, subarachnoid hemorrhage, meningitis, encephalitis, cysticercosis, head trauma, cerebrovascular accidents, hypertensive encephalopathy. However, simple partial seizure have following clinical features: causes motor, sensory or automatic or psychic symptoms without an obvious alteration in the consciousness. Motor seizures include and they arise from the contralateral motor cortex. Jacksonian march movements arise from a restricted region and progress over seconds to minutes to a larger portion of the extremities. PQR14, patient cannot sit up from nausea and fainting. The feature suggests to be the postural syncope. Syncope is a fainting due to sudden fall of blood pressure causing brain ischemia. Postural syncope occurs due to an abrupt change in the body position when patient is lying down and suddenly stands or sits up. It is associated with dizziness and nausea a few seconds before the fainting. Predisposing causes include dehydration, quick change in position, standing or sitting still for a long period, anemia, hot weather, and hyperventilation. The types of syncope we have to keep in mind is vasovagal syncope. It is the most common type. Occurs when the body overreacts to certain triggers such as the sight of blood, extreme emotional distress, anxiety, pain, and hunger. Cardiac syncope is seen in cases of cardiac arrhythmias, congenital heart diseases, heart valve disease, aortic stenosis, or heart failure. Neurogenic or neurological syncope is seen in and caused by neurological conditions such as seizures and stroke or transient ischemic attack. PQR 15, great thirst for large quantities at large interval. The common causes of thirst include dehydration. People who are living in tropical countries sweat heavily. That can cause dehydration. In case of gastroenteritis, diarrhea and vomiting causes good amount of fluid loss. Severe physical exertion like football, tennis and cricket cause sweating and extensive fluid loss. Diabetes is one. Great thirst can be a sign of diabetes and it is associated with polyuria and extreme fatigue. Pregnancy, frequent urination and feeling thirst is common in pregnancy. Other causes of thirst is iatrogenic. Certain medications like diuretics and antipsychotics. Diabetes insipidus is caused by lack of antidiuretic hormone, which is also known as vasopressin. ADH enables the kidney to retain water in the body. Psychogenic polydipsia, here the people with certain mental health conditions like schizophrenia may drink water compulsively. PQR 6, we find headache when stooping as if brain would burst, through forehead, from ironing, on coughing, in morning after rising or when first opening eyes, commencing in the morning, gradually increasing until evening from constipation. So there can be certain reasons for cough headache, and cough headache is one. This type of head pain triggered by coughing and other types of straining. This may include sneezing, blowing your nose, laughing, crying, singing, bending over, or having a bowel movement. Cough headaches are fairly uncommon and self-limiting. Early morning onset type of headache are most likely due to chronic tension type headache, having the worst severity at the time of the day. Other conditions include migraine, depression, withdrawal effects from the pain medication, ergots, caffeine, and these are the things which often produce this pattern of headache. PQR 17, there is a pressure as from stone at the pit of the stomach, relieved by eructations. Bryonia has these symptoms due to digestive weakness. A feeling of pressure in the epigastrium is usually the result of digestive disturbances we call dyspepsia. The most common causes are gas, constipation, indigestion, food poisoning, irritable bowel syndrome, hiatus hernia, gastritis, and pregnancy. The gases commonly causes distension and bloating and tightness in the abdomen. A person is better by belching or passing wind or gas. There are some possible reasons for gas, that is swallowing air, for example by eating fast or drinking fizzy drinks. The natural process of breaking down the carbohydrates in the gut also produces fermented air. IBS is or you can have the food intolerance. Preventive measures include eating and drinking slowly, stop smoking and drinking fizzy drinks, take less of vegetables and carbohydrates because they ferment in the intestine and cause flatulence or gas. PQR 18 tells us about the constipation. Inactive, no inclination, stool large, hard, dark, dry as if burnt on going to see. So stool less than 3 times per week is constipation. Constipation can occur when the stool passes through the colon too slowly, as the water is absorbed in the colon, making feces harder. Other causes include less fiber in the diet, lack of exercise, and overuse of laxatives. Clinically, Bryonia constipation, it appears due to dryness of mucosa as well as poor intestinal motility. The condition is usually known as slow transit constipation. It is characterized by the reduced mobility or motility of the large intestine caused by abnormalities of the enteric nerves. The usually slow passage of waste through the large intestines leads to chronic problems such as constipation. PQR 19 tells us about the diarrhea during a spell of hot weather, bilious, acrid with soreness of anus, like dirty water, of undigested food, from cold drinks when overheated, from fruits or sauerkraut, worse in the morning, on moving, even a hand or feet. So let us recall Acute diarrhea is defined as 3 or more loose stools per day. Diarrhea is usually caused by an infection and it begins 12 hours to 4 days after exposure and resolves within 3 to 7 days. It occurs more in the summer weather than any other season because bacteria thrive more in warm weather. Clinically, we find contaminated food and water are the main cause of acute diarrhea. Infectious agents for the diarrhea include viruses such as calicitrine virus, adenovirus and rotavirus, bacteria such as E. coli, Campylobacter, Vibrio cholerae, Shigella, Salmonella and Staphylococcus aureus. Parasites are Giardiasis, Giardia lambda, Cryptosporidium and tapeworms. Acute diarrhea can be life-threatening to babies and young children. This is because their smaller bodies are more vulnerable to dehydration. PQR 20 tells us about the mamma is heavy, of the stony hardness, pale but hard, hot and painful, must support the breast. The above feature corresponds to inflammation of the breast known as mastitis. Commonly, mastitis occurs during the first 6 weeks of the breastfeeding. Signs symptoms include breast is red, swollen, tender or warm to touch. Fever is there, pain while breastfeeding. PQR 21 tells us about the cough, which is dry, spasmodic with gagging and vomiting, with stitches in the side of the chest, with headache as if head would fly to pieces, worse after eating, drinking, entering a warm room and deep inspiration. The dry spasmodic Bryonia cough can be a symptom of smoker's cough, tracheitis, bronchitis. Allergic could be house dust, smoke, pollens and bronchitis. When associated with stitching pain in the chest, it needs to rule out the dry pleurisy. Iatrogenic causes also are important. Rare causes can be GERD and COPD, whooping cough and eosinophilia. Thank you friends for patient listening.